Welcome back to On the Clock, our show about making the moments matter. I'm your host, Elisa Gums. Today, we're chatting about the very life and death effects of racism in our healthcare system with Dr. Uché Blackstock, the founder and CEO of Advancing Health Equity and author of the best selling book, Legacy: A Black Physician Reckons with Racism in Medicine. Dr. Uche, we're so excited to have you on the clock. How are you today?
I'm doing well. Thank you so much for having me.
You have such an amazing story. Your mother was a doctor. Both you and your twin sister followed in her footsteps, becoming the first Black mother daughter graduates of Harvard Medical School. Was there ever a question for you about your calling?
No, that's an easy answer. No, because my mom, our mother was such a tremendous influence on us. I mean, I grew up thinking that most doctors were Black women just because, my mother exposed us to so much. She was committed to her patients, community, and also was a leader in our community with other Black physicians. So she exposed us at a very early age to what it means to work in service to your community and the importance of that. And I have to say, I never considered anything else.
In 2019, you founded Advancing Health Equity to help close the racial gap in healthcare. Tell us about the work that you do there.
Yeah, so just to say, I left my job in academic medicine. I left my career in academic medicine because I felt like I couldn't do this kind of work, the work around racial equity and health equity, in healthcare in a way that was authentic to me, where I could bring my full self. So I was like, I guess I gotta found my own organization and do it my way. But yeah, so that was in 2019. Even before the pandemic hit, it was clear to me that racial health inequities that disproportionately impact, especially Black communities, was something that I had to do my part in addressing. And so we work with healthcare related organizations, whether they be academic medical centers, health systems, hospitals, startups, around creating diverse, inclusive organizational environments, work environments, but also we know that trickles down to how they interact with our communities and how the care is delivered. So we also do external facing work as well. And it's been incredibly rewarding. People ask me, they're like, oh, would you ever want to go back to academic medicine? I'm like, no, 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 I'm doing my thing. I'm doing it my way. It was scary to make that leap because I was in a role where I had like multiple titles. People would look at me like I was like happy, I'm so successful, but you're not successful when you can't bring your full self to your job. And really, it's also such a loss for organizations when we as Black women can't do that. They really lose out on so much. But so I made a really difficult personal decision to start advancing health equity. And it was one of the best decisions that I ever made.
You talked about leaving that position. So you were a practicing physician at one point, an emergency medicine professor, and then a director in the Office of Diversity Affairs at a medical school. You mentioned that you couldn't do it authentically. You couldn't bring your full self to work. You've also said that you didn't feel valued there or really empowered to make real change. And I think so many Black women can relate to that. Can you share what that experience taught you?
Yes, I mean, I have to say that it really was a radicalizing experience for me because I think, I'll say this. I feel like, especially in medicine, you kind of like, you're checking off the boxes, you're pre-med, you do you go to medical school, you do your residency, you get a job. Like, you're like, okay, I think I'm doing everything that I'm supposed to do. And, you're not really reflecting on like, am I thriving, right? Am I, or just surviving in this environment? And so I had these series of experiences, being in the Office of Diversity Affairs and kind of being silenced and muzzled in my role and not being empowered in my role. I had gone up for promotion and I thought it was going to be a slam dunk. I thought I had done everything I was supposed to do. I didn't get my promotion the first time to associate professor. And I say, like, those are like slaps in the face, and it was like slaps in the face that I needed. Sometimes like you just need a wake up. No, because I realized I was really probably just like being very passive about like my career, even though it looked like I'd accomplished so much. And so yeah, I learned that a lot of times you just have to make sure that you're in alignment with the environment that you're in. I'm not saying like everyone has the privilege to leave their jobs, but I think for us, especially as Black women, we have to ask ourselves, like, is this an environment where I'm being appreciated and valued? Is this an environment that aligns with my purpose, my vision, my values? If it's not, then I think there's some difficult decisions that you have to make.
So you left to start your own organization. You call the work really rewarding, but we also know that it's really hard. What have you found to be most challenging when working with healthcare organizations? Like, what are the elements that are most resistant to your anti racism efforts?
Yeah, I mean, I think, a lot of times when we interact with our client organizations, we try to do like some important vetting up front to find out like who is doing the asking in terms of the work. Is this something that we have buy-in from leadership, or is it that there are people, other people within the organization who don't have as much power and influence that want it? And I think that what's really important is that everyone is on board with the work that needs to be done, and they have an understanding of the power dynamics within the organization. They have an understanding that the work has to be intentional, that it's not just a one and done, and that it's for the long term. And so those are some things I make sure that we talk to our client organizations about. Sometimes people slip through and they're just doing it for like a check box. But I think a lot of times, what's been reassuring is that there are organizations that want to do the hard work. They just need some help with it. So we do a lot of capacity building, technical assistance, just equity work, because I think a lot of times organizations have just a challenging time about how to operationalize it, like what equity work looks like. And so we help them with that.
And what does success look like in that work for you? Like, give us some examples of the kinds of things that you are transforming.
Yeah, I mean, I think we're transforming culture within organizations, and I think often, and I know so many people probably listening have gone through this. It's like just listen to the folks, the marginalized folks in your organization. Just listen to their feedback, and there you have it. Like you don't need to go to a consultant, but a lot of times they often will come to us because they see us as like an independent, you know, body that we're coming in. We don't have any preconceived notions, and so we've really been able to work hand in hand with, or we call it a partnership with our organization in terms of what does like a long-term strategy look like around equity. And the best part is that we've actually been able to work with organizations for years. So initially the engagements were much shorter, and now we see that they really like appreciate the work that we do, and they need us. They need us really to help make sure that that organizational change is sustainable and long lasting.
For people who haven't read the book yet and don't understand the connection, can you draw the line for us between the work that you're doing with these healthcare organizations and how it impacts the health of communities of color?
Yes. Yeah, no. So legacy, has a double meaning, that it's being legacy of being a second generation Black woman physician, but also legacy of medical racism that results in like the horrific statistics that we still see today. And a lot of it is about what happens like within organizations. Are they recognizing the organizational inequities? Are they recognizing how it trickles down to how they interact with communities, and patients? And so I feel like the part that I can do with advancing health equity is working hand in hand with these organizations on like how do you retain Black health professionals? How do you make sure that you are delivering culturally responsive care to your Black patients? How do you make sure that you are prioritizing the needs of Black communities? So those are always like the priorities when we work with healthcare organizations, that we help support them in their goals.
Let's dive into legacy because you just were talking about, being the second generation. The opening of the book talks about your mother's work. And the thing that really moved me about it is that you described how she wasn't just treating patients, but she was treating her neighbors. And she wasn't just assessing them physically, but she was really concerned about their whole being.
Yes.
Many of us aren't familiar with some of the terms: structurally competent, culturally responsive, or racially concordant.
Hmm.
Can you explain what they mean and why they're
Sure.
so important?
Yes. So structurally competent is this idea, and I differentiate it from cultural competency because I feel like cultural competency has sometimes delves into like actually stereotyping patient populations. We've seen that, and then also we can't really expect like a health professional to be fully competent in someone's culture, but we can expect them to have a better understanding of where a patient is coming from in terms of what's happening in their communities or wanting or feeling obligated to know that. So I always say that when a patient and a physician are in an exam room together, it's more than just a patient and that physician. You need to know what's going on in terms of food insecurity, housing insecurity, what's happening at their jobs, are they experiencing discrimination? So it's really understanding like holistically what care looks like or what health looks like for that patient in their lives. The other thing is, in terms of culturally responsive, just being able to understand, like, just where your patient is coming from, right? And to having, and that's why diversity in healthcare is so important because we need to have health professionals who understand culturally where their patients are coming from so they can best care for them. And then racial concordance is this idea of the patient and the health professional are from the same racial background. We see that with Black patients, racial concordance, especially in patient physician relationships, is very important, that it can actually improve outcomes for Black patients, that it makes a difference. Black patients are more likely to follow their physician recommendations. They're more likely to leave the interaction with a more positive feeling. They're less likely to be spoken over by their health professionals. So, and there was even a study that came out last year that showed that even having one Black physician in a US county improved life expectancy for Black patients and even white patients in that county. So there are so many positive things about, racial concordant care, but most importantly, it's that for our patients, it matters the most.
Yeah, absolutely. It's as you bring up in the book, it's a matter of trust. It's a matter of being willing to open up. And it's a matter of feeling like someone is there to listen to you, right?
Yes. Yes. Oh, absolutely. And I feel like for so many of our patients, they don't get that. They get ignored, dismissed. Their concerns are minimized when they seek care. And for that to happen when people are feeling ill or at their most vulnerable, I think is unconscionable, but it happens so very often to us.
Aside from training more Black physicians, how do we increase the likelihood that Black people will get this kind of care that we need? I know you lay out sort of a multi-pronged approach.
Yeah, I mean, I think obviously, ideally, I wish we could have increased diversity in our health professionals, but I think also there should be an expectation that non-Black health professionals know how to care for Black patients. And so I think a lot of that, I say there's a lot of work that medical schools need to do, but honestly, it has to start before that. The fact is that people who become health professionals, they're the same people that are our neighbors, that are our colleagues, like they they internalize or they absorb all of the anti-Black cultural messaging that is around them, whether it's from their family, the media, school. So we should not necessarily expect them to think any differently, right? So that's why I always say, like, when we're thinking about you know anti-racism, right? Or thinking about how to make sure people don't have biases. It starts way, way, way before medical school. It starts even before college, right? And I feel like that's why we have these attacks on you know anti DEI attacks within education, because there is this movement to wanting to make sure that everyone understands what our history is and how we arrived to where we are today. But people don't want that history to be revealed. But it's so,
Yeah.
so important to understanding why we see the statistics and trends that we see today.
Yeah, and we're going to talk about that backlash a little bit later. But as you were talking about the fact that this starts, well before people are in medical school,
Yeah,
I was just thinking about the real life example that we were all given just, I don't know, a month or two ago with the nursing student who was saying that, Black people aren't country and was talking about picking cotton and like, all sorts of things
I
that have
know.
nothing to do with
Right.
giving good care to a patient. And so, one of the things I wonder is that if you, who grew up thinking that Black women doctors were the norm because you saw it everywhere, so you had great examples to follow, you had tons of
Yes.
experience with it, but even you didn't realize how big the problem was until you were
Yes.
working within the system. How do we change the minds of people who they're not invested in this the way that we are?
I know. No, I know. I know. I know. I know. I know. I mean, so one thing that, and I think you said we're gonna get into this, but one thing that I've been thinking a lot about is like coalition building, that especially as we head into an election and we're seeing more anti-DEI efforts, we really need to think about like who are the other groups and organizations that black black physicians, black healthcare professionals that we need to coalition build with, because I recognize that we are not going to be the ones, just us. We cannot be the ones to solve these pressing issues. That and also I also think about, we have to coalition build with even black folks in the legal profession and other industries and disciplines, because a lot of these efforts are coming from all different sides. And I also want to say, I know that there are non-black folks out there that also care deeply about these issues, that we also need to bring on board, because I always say you have to load the boat, right? Load the boat when we're dealing with this, because it can't just be us.
Yeah. So the book is part memoir, it's part history, it's so educational, but it's also a call to action. And you state plainly in the book, if you're not furious, then you're not paying attention. What actions were you aiming to provoke when you wrote the book?
Yeah, so I wrote the book for several reasons. I wrote the book, one, to affirm the experiences that Black patients have in healthcare, that Black health professionals that we have in our education and training, but I also wrote it for other folks to recognize that, why in 2024 we are seeing the statistics that we see, that even despite advances in innovation, technology, research, that we still are seeing a worsening of Black maternal mortality crisis, right? Worsening infant mortality, like, and that there's nothing wrong with us inherently as Black people, but that there is something very, very wrong about the systems in this country, healthcare, criminal legal, educational system, where we are not able to thrive and lead long, full lives. And so the last chapter, the call to action chapter, I address different groups of people. I address white health professionals to make sure they understand that this is not just our problem; it's their problem too. I also address like policymakers, because I like to think about what health looks like in all policies. That health is not just about what a physician recommends to a patient. It's not just about, oh, eat well, stop drinking alcohol. It really is about like what is happening on a community level for people, right? Like what's happening in their homes, like having a broader understanding of what health looks like and how we can make healthier communities.
As we were talking about the backlash, we've seen so much pushback against diversity, equity, and inclusion policies this year alone. But the overwhelming response to your book has been encouraging, at least
I
for me.
know, I know.
What are some of the conversations that are now happening around the book or because of the book that give you hope?
Yeah, like there was one school where a med school that had my book as their campus read. So everyone, including the faculty, the president, they read it, and you know the president's like, I took notes, and and we're having a meeting about how we can implement some of what you recommended. So a lot of when I think about change, I think about organizational change, I think about systemic change. I think about what people can do on an individual basis in their own personal lives, right? Um, because I try to keep hopeful. I try to keep hopeful in the book, but I'm really just, my heart hurts. My heart hurts that we have to worry about what happens to us when we go to go see a doctor, that we are not able to live long, full lives in this country because of how this country treats Black people. My heart hurts for that. And so, I have to say the book has brought me to places I never thought I would go. Like I spoke at the United Nations a few months ago for their International Day for the elimination of racial discrimination. But being able to talk about some of these issues in a global community, realize these are the people that need to understand these issues too, because they're part of the diaspora as well.
Yeah. I'm so glad you mentioned individual change because I want the people who are watching us to walk away with things that they can do. So, for the women out there, what can they do for themselves, for their families, to get the most equitable care
Yeah.
possible?
Yeah, and I have to say, like, that question, I always have a challenge with, just only because it's like these are systemic issues that we're dealing with. It almost feels unfair to ask us, especially when we're at our most vulnerable, to feel like you're going to war when you're going to see a doctor. But I always say, like, I don't know if you saw, but there was this, you probably saw it, this TikTok video, a white doctor wondering why most of his Black patients, when he goes into the room with them, they have someone on FaceTime during the appointment.
I did not see it, but like again, a Black person wouldn't wonder. I already know intuitively the answer to that, but go ahead.
Right, because we don't trust you. We don't trust you. And we need someone there to basically for surveillance to make sure that we're getting the care that we need. So, whether it's someone on FaceTime, whether it is someone that you bring with you. I always say bring a loved one, a trusted friend to your appointment with you, because one, for moral support. Two, sometimes when you're not feeling your best, they can help ask questions on your behalf. Three, make sure that you're being treated properly, to take notes. The other thing is, I think, to be very clear about what's happening with you. So when you go in with notes, because a lot of times you may forget. So document your symptoms. How long have they been lasting? What are the symptoms? What makes them better? What makes them worse? Like, just have as many notes as possible. What have you done that's helped? What hasn't helped? And then I think it's important that when you leave the appointment, you have the answers you need. So, ask the health professional, what do you think is going on with me? What is your plan? What is your follow up for me? What are red flags that I should return for or go to the emergency department for? Right? So I think those are really important. The other thing is, of course, like Black women, we are the ones that are leading the solution. So I always have to give a shout out to Health in Her Hue, which is a directory of culturally responsive health professionals who want to work with women of color and Black women. So, and they also have patient education. There's the Earth app, IRTH app, that a Black woman started, which was just a maternal health provider directory. So there are, like, I love that we're leading some of the solutions to make sure that we're going to get the care that we deserve.
Yeah. And I totally agree with you that it's unfair to ask us, to fight the fight when we need the care. But we also, know
Yeah,
from our history that we've got to arm ourselves with
exactly.
whatever tools that we can. Hopefully, this question is a little bit more toward the systemic change. But, I think that patients don't always think of themselves as consumers. And
Mhm.
collectively, we do have a lot of power that way. So, what can the women who are listening do as consumers to spur change in the medical field?
Yeah, I mean, I think that, for example, reviewing your experiences with health professionals, like putting those are really really important. Whether it's like when the hospital sends you the survey or putting it online, like what your experiences are. I think also just the informal network of sharing with each other, like who are like your best dermatologist, OBGYN, like that informal circle, I think is so powerful because, of course, you're going to trust someone that like your girl or your best friend goes to. So I think those are things that we have to just like stay community minded, use our resources that are available to us.
Yeah. You have built such a far reaching platform as a speaker, as a book author, as a medical contributor for MSNBC and NBC News, and also, contributing articles and op eds to publications such as the Washington Post and New York Magazine. But if there was one message that you could beat like a drum constantly, that you want to make sure our audience hears and walks away with, what would it be?
Oh, I would say that a lot of the solutions that we have to help health inequities are happening within our communities. There are so many wonderful community-based organizations that we can support, donate to. We can help amplify their message. We can volunteer with. Like I talk about in the book, there is a birthing center in Minneapolis. That Minneapolis has some of the highest maternal mortality rates. Black woman midwife founded it, and they actually are making a difference in terms of decreasing maternal complications and preterm delivery. So look and see what is happening around you in your neighborhood, locally, hyper locally. How can you help support these efforts, especially Black women-led efforts? Because we have the solutions, and we just need more support and amplification.
So find the Black women who are out there working toward the solution
Yes,
and help them in whatever ways they
yes,
need. Volunteer, donate, support them with your money and your mouth,
yes,
right?
exactly.
Perfect. This has been so insightful. Thank you so
Thank you.
much
It was so much fun.
for sharing the unique ways that you're helping people make the most of the time we've been given by literally fighting for the lives of people of color. I can't say how much we appreciate you and the work that you're doing.
It was a pleasure. Thank you for having me.
And thank you all for watching On the Clock. We'll see you next time as we continue to talk about working with purpose and living with passion.